Today our class is about radial nerve. It is very important for 5 marks as well as in the essay question. Today our class is about radial nerve. Before starting the class, please subscribe to our channel and next follow us in Instagram for notes available in Instagram. Next, coming to the point, while studying in the radial nerve, while studying about radial nerve, we have to know about the root values of radial nerve as well as course of radial nerve, as well as relations of the radial nerve, branches of radial nerve and clinical anatomy of radial nerve. These are the 5 concepts that we are going to study about this radial nerve. Now coming to the root value of radial nerve, coming to the root value of radial nerve. So the root value of radial nerve is from C5 to C8 as well as T1 segments of brachial flexus. These are ventral rami of C5, C6, C7, C8 and T1 of brachial flexus. These are the root values of radial nerve. Next, coming to the point of course. At the axilla region, at the region of axilla, see, it lies against the muscles. That means here is the axilla, that means here is the axillary artery, here is the axillary artery, this is the first part of axillary artery, this is the second part of axillary artery, this is the third part of axillary artery. See, radial nerve exactly located posterior side of the third part of axillary artery. That means here. Okay, radial nerve is located exactly at the posterior side of third part of axillary artery in the region of axilla. Okay, it lies against the muscles of subscapularis, teres major and latissimus dorsi muscles. Okay, next, at the end of this axillary region, it comes out, it comes lateral to this axillary artery, third part of axillary artery, then it enters into the posterior side of the bone through lower triangular space. This is the lower triangular space. We have studied about lower triangular space in the last class of intermuscular space. This is the lower triangular space. Through lower triangular space, it enters into the posterior side of humerus at the region of axilla. And coming to the radial sulcus. Axilla is the first region and second region is radial sulcus. Coming to the region of radial sulcus, it enters into the radial sulcus through the lower triangular space. And the border, we have already know that the borders of these boundaries of this lower triangular space, superior side there is lower border of teres major, and at lateral side, at lateral side we are having humerus, and at medial side long head of triceps brachii. Okay, this is the boundaries of this lower triangular space. From the lower triangular space, it enters into the radial sulcus along with profunda brachii vessels. In the profunda brachii vessels, it gives three muscular branches and 2 cutaneous branches. Okay, first one is lateral head of triceps brachii, one branch to the lateral head of triceps brachii, one branch to the medial head of triceps brachii. I will draw here clearly. One branch to the lateral head of triceps brachii, one branch to the medial head of triceps brachii, and one branch to the anconeus muscle. One branch to the lateral, one branch to the medial head of triceps brachii, one branch to the anconeus. Okay, these are the muscular branches. Now coming to the cutaneous branches, one branch to the posterior cutaneous nerve of forearm, one branch to the lower lateral cutaneous nerve of arm. Okay, these are the branches that arises from the radial nerve at the region of radial sulcus. And I forgot to tell, at the region of axilla, there are 2 muscular branches and 1 cutaneous branches. See, the two muscular branches are first one is long head of triceps brachii, as well as the second one is medial head of triceps brachii. Next, coming to this cutaneous branch, this cutaneous branch is posterior cutaneous nerve of arm, because axilla is present at the region of arm. These are the branches that arises from radial nerve at the region of axilla. Now coming to the third region, front of arm. Coming to the third region, front of arm. At the front of arm, it descends on lower and lateral side of front of arm, deep to the interval between brachialis, and that means I will say clearly here. Here there is brachialis muscle. Here there is brachialis muscle at the medial side, and here there is brachioradialis and extensor carpi radialis at the lateral side. This region is arm, this region is forearm. Okay, from at this spot at medial side there is brachialis, at the lateral side there is brachioradialis, and extensor carpi radialis longus. Okay, it descends in between these two muscles and reaches capitulum of humerus here. This is the capitulum of humerus, this is the radius bone, and reaches this capitulum of humerus bone. This extensor carpi radialis longus not completely involved. It is at the that means at the initial stage. And this is the spot of front of arm, and in this region we are having three muscular branches. The first one is brachioradialis, and one branch supplies to the brachioradialis, one branch supplies to the this is brachioradialis, one branch supplies to the brachioradialis, one branch supplies to the brachialis, and one branch supplies to the lateral part of extensor carpi radialis longus. These are the three muscular branches that are present in a radial nerve at the region of front of arm. Next, coming to the cubital fossa, at the region of cubital fossa, this is cubital fossa. Here is the medial nerve here. At the region of cubital fossa, the cubital fossa terminates into superficial and deep branches. This is the deep branch from here, and here is the superficial branch from here. Okay, it divides into two branches, deep and superficial branches at the region of cubital fossa. Okay, next, these deep branches supplies to extensor carpi radialis muscle. Okay, here extensor carpi radialis brevis. This deep branch supplies to this muscle as well as supinator muscle. Extensor carpi radialis brevis as well as supinator muscle, and it courses between two heads of supinator muscles. Okay, next, it has two muscular branches. That means this deep branch, that means at the region of here, where at the region of cubital fossa, the deep branch supplies to the two muscles. So there is two muscular branches. First one is extensor carpi radialis brevis, second one is supinator muscle. These are the two branches, that means deep branches, and that's it. This is about the region of cubital fossa. Now coming to the front of forearm. Now coming to the forearm region, that means this region, forearm region, front of forearm region. At the front of forearm region, these superficial branches, this is deep branch, this is superficial branch. This superficial branch leaves the cubital fossa to enter lateral side of front of forearm. Okay, it enters the lateral side of front of forearm by accompanying with the radial vessels. That means radial nerve, radial veins as well as radial arteries. Okay, next, this is the region of front of forearm. The superficial muscle, nerve, superficial branch supplies to the lateral side of front of forearm. And at the region of front of forearm, the cutaneous muscle, cutaneous branches arises. The cutaneous branches supplies to the lateral side of forearm as well as radial vessels. Lateral side of forearm as well as radial vessels. That means radial artery as well as radial vein. Yes. Now coming to the point, region of wrist and dorsum of hand. coming to the region of wrist as well as dorsum of hand. In this region, the superficial branch descends till anatomical snuff box. This is the anatomical snuff box. From here to the lateral side, it descends up to the anatomical snuff box to reach the dorsum of hand. At the dorsum of hand, it supplies to the skin of lateral half of dorsum. It supplies to the skin of lateral side. Supplies to the skin of lateral side. Okay. Next, it has two articular branches, two articular deep branches, two articular deep branches. The two articular deep branches that are inferior radioulnar wrist, and intercarpal joints. And it has cutaneous and vascular branches as well as articular branches at the region of these two are deep branches. Now coming to the superficial branches, there is cutaneous branch, vascular branch as well as articular branch. These supplies to the skin of lateral side of anatomical snuff box as well as to the wrist. Skin at anatomical snuff box as well as wrist joint of first carpo-metacarpal joints. This supplies to the skin of anatomical snuff box as well as wrist joint at the region of carpo-metacarpal joints. Next, coming to the region of back of forearm and wrist. Region of back of forearm and wrist. This is the dorsum of hand, this is the back of forearm and wrist. Okay, now coming to this region, see the deep branches of a radial nerve enters into the back of forearm. See the deep branches enters into the back of forearm and supplies to some important muscles. Those muscles are abductor pollicis longus, extensor pollicis brevis, extensor pollicis longus, extensor digitorum, extensor indicis, extensor digiti minimi, extensor carpi ulnaris. Okay, at the region of back of forearm, the radial nerve gives branches to the abductor pollicis longus, extensor pollicis brevis, extensor pollicis longus, extensor digitorum, extensor indicis, and next extensor digiti minimi as well as extensor carpi ulnaris. These are the 5 muscles. These radial nerve supplies to these 5 muscles as 5 branches. These are the regions that we have covered till now, and these are the regions that involved in the radial nerve. Now coming to the relations of the radial nerve. Now coming to the relations of the radial nerve. See in the axillary region relations. In the axillary region, it is related to the posterior side of axillary region. We have already studied. It is posterior to the axillary region, and at the region of brachial artery, it is posterior. If think that it is the brachial artery, it is posterior at upper arm. It is posterior at upper side of brachial artery. That means, see, this is the axillary artery. This is the third part of axillary artery, and this axillary artery continues with the brachial fluxus. And this radial nerve comes from this third part of axillary artery to the brachial flux and then enters into the dorsal side of the hand. Okay, next, so that it is present posterior to the axillary artery, third part of axillary artery as well as upper part of brachial artery. Next, it at the lower triangular space. It is medial. The relation at the lower triangular space. The relations of the radial nerve is at the medial side there is long head of tragus brachii, at lateral side there is shaft of humerus, and at the superior side there is lower border of teres major muscle. Lower border of teres major muscle, long head of tragus brachii. Next, coming to the spiral region. In the spiral groove, radial nerve is related above with lateral head of triceps. Next, in the cubital fossa, it lies lateral to biceps tendon. Here is the biceps tendon like this. Here is the biceps tendon. It lies lateral to the biceps tendon. It is the Next, coming to the clinical anatomy of this radial nerve. In the clinical anatomy, see, if there is a fracture of humerus, there may be injury of radial nerve. If there is injury of radial nerve, there may be cause of no extension of elbow joint. There may be loss of extension of elbow joint, as well as there is wrist drop, as well as there is loss of sensory loss, no extension of elbow joint, wrist drop. Next, these are the clinical anatomies that included in the radial nerve, as well as in the radial growth there is compression of radial nerve while lying in an armchair, results in Saturday night palsy. I will provide pictures in the Instagram. Thank you all.